Okay, so let's see. First of all, we're gonna find UB1, which is that Jingming or bright eyes. Yeah. So you start off at the inner canthus. If you want to, you can close your eyes. Okay. But this is the inner canthus right here. We're gonna go medial this way and superior. So we're going this way into this corner right here. Right now I can feel the medial orbit of the eye right here, yeah? Medial orbit of the eye socket. Okay. So if I were going to needle this point, I would ask the patient to look this way, like with her eyeball. Okay. I would kind of push the eyeball further laterally, and then I would insert the needle in this direction. Okay. Again, definitely not this way, because you're just going to insert into the eyeball eventually, and not so much this way perpendicular, but kind of this way to hug the orbit of the eye socket right there. That would be UB1. Okay. UB2, directly above the inner canthus, so just sliding up here, the medial end of the eyebrow. Okay. Again, I would recommend really trying to feel for that depression on the medial end of the eyebrow rather than just looking for the actual medial end of the eyebrow. Just feel for a depression here. This would be where I would locate UB2. This is the zanzhu, the gathered bamboo. Okay. And then after UB2, we go up into the hairline. So we just slide straight up about 0.5 cm within the anterior hairline. So this is 1 cm, about 0.5 cm within the anterior hairline to UB3. And this point is called meichang, where the eyebrow's pouring. Okay. The next point is the chuchai, or the crooked curve. And that point is called that because from here the channel is going to go lateral. Okay. And we want to be 1.5 cm lateral to the midline. Okay. So there are many ways to do that. I can take like 1.5 cm this distance and just go from here. Yeah. If you're able to, you can also feel for stomach 8. Taken from the corner of the hair, corner of the forehead right here, 0.5 cm within its way, yeah. And divide that distance into thirds, okay, to find like your 1.5 cm. So about here, yeah. But again, we go half a cm in. We're gonna go 1.5 cm lateral. So feel this point right here. So this is UB4. Okay. From here we go half a cm straight back to UB5, which is the Wuchu, or the 5th place. Okay. So I would just slide my finger, slightly back, 1 cm back to this depression here. And then you always want to sorry, my finger slid up a little bit. It's good to kind of refer back, like look from the front to make sure that you're keeping your straight line. Okay. That would be UB5, Wu2. Okay. From here, we're gonna slide back 1.5 cm, 1.5 cm, 1.5 cm. Okay. So from UB5, we go 1.5 cm. Sometimes you can actually feel these depressions. This is where I would locate UB6, okay, on this line. Okay. And then UB7 should be about here. Okay. And UB8 is another half cm back. I'm sorry, 1.5 cm back. And for UB7 and UB8, okay, if you wanted to check UB7 and UB8 can be located sort of with reference to due 20. Okay. So I'm just going to make a rough estimate of due 20 right here. I use the posterior, this is her ear right here, and this is the posterior edge of her ear, and I trace this line straight up to due 20. And yeah, the UB7 should be about 1 sun in front of due 20, and UB8 should be half a sun behind due 20. Okay. I know that might be a little hard to see. Okay. I'm going to have you turn this way. Okay. And I'm going to try to find UB9 and UB10. Okay. So first I'm going to locate her UB10. I think it's going to be a little easier to see. Okay, thanks. Okay. So for UB10, first I'm going to find the vertical level. I start at the EOP, so I can feel her EOP right about here. Okay. Let's see. EOP. And then I slide my finger down into that deep depression at due 16. Okay. From here I'm supposed to go another half a sun down. Okay. So that would be the vertical level for UB10. And then to find the 1.3 sun lateral, all I do is I try to pinch the back of the neck at this level. Okay, you can kind of see these are the trapezius muscles right here. At the top of the neck, it gets kind of narrow, and then as it goes down, it flares out. All of this is trapezius over here. Okay, but right now I'm kind of pinching the lateral edges of the trapezius muscle. So UB10 would be needle this way. Yeah, this is Tianzhu, the celestial pillar. Okay. Now going back to UB9, the Yuzhen, the jade pillow. Okay, so this is 1.3 sun right here, when I'm pinching here. To find the vertical level for UB9, we have to start at the EOP again, and then this time we slide up from the EOP into that slight depression above the EOP. And then that's my vertical level. Okay. I'm going to try to place my fingers right about where these fingers are down here to get the 1.3 sun. So this would be about where UB9 would be on the back of her head, okay, on both sides.